Well, arthritis is part of, or one of the reasons we can get lower extremity pain. In the foot and ankle specifically, it's more common in patients who have had a lower extremity injury. So those people who say I have an old football injury about my knee, it's actually much more common in their ankle or their foot to have a long ongoing issues with their foot or ankle after an injury. So every time you twist your ankle or sprain your foot or whatever, there's often repercussions with that as you get older that you recognize later on. Yeah, some of those are soft tissue injuries, like a sprain is a soft tissue injury to a ligament, which is injured and heals with scar tissue and generally can do pretty well. But injuries that involve the joint surface or the joint surface cartilage, there are factors or things that occur that begin a process of degeneration that slowly occurs over time. So you recognize that as loss of cartilage in the joint, which is what arthritis is. So you recognize that later on as pain or inflammation, stiffness in the joint, and that can be recognized with an X-ray or another imaging study as a loss of joint cartilage. So arthritis is specific to the joint and specific to the cartilage in the joint that involves that surface. Sometimes there are some activities you might not be able to do anymore because of the stiffness or the discomfort that you have. But when we're starting to talk about being able to stay active, actually being active is one of the best things you can do to help relieve the pain that you're having. So even if you can't do the thing that you want to do the most, I might not be able to play soccer anymore as an example, but there may be other things that I can do that help me stay active and help keep that discomfort and that stiffness and those things at bay by being active. We don't know that we're actually able to manage the progression other than managing the symptoms. So really, I guess what we're talking about today is trying to manage those symptoms. And some of those things, we talked about stretching a little bit. Ointments or gels, some people will use that, like capsaicin cream or BioFreeze or some of those things which are topically applied and available over the counter, and you can use those to help manage discomfort in the foot, ankle region. Those are very useful. Some of the other things you can do, the stretching that we talked about, soaks. People use warm or cold compresses or soaks to manage their foot pain. Epsom salts is a thing that comes up often in the office, and that's more of a muscular pain kind of a thing, but it seems to have some benefit in foot and ankle. I have patients who do get some benefit from that. Most shoes are made for most people, right? So most of us don't have an issue. We're talking specifically to people who have problems with their foot and ankle pain. So those people who haven't fit into the most shoe category need a little help in figuring out which end of the spectrum they're on. Maybe they have too high an arch, maybe they have pronating or a foot that's too flexible in the middle when they run, and being able to figure that out is often difficult on your own. So getting some help with that is beneficial, and then the best thing is that you get some parameters or the kinds of shoes to look for, and then you can start to do that on your own and kind of work that out yourself. But it's helpful to get some professional help when you're stuck outside of the most people or most shoe category. Otherwise, if you're a baseball player, there's baseball cleats, right? Those are made for that sport. There are soccer shoes for soccer players, and they're made for that sport. Running is even different, right? There's a huge spectrum of shoes for running, and people have the most difficulty in those areas. And if you're having a hard time getting a shoe that works for you, or having foot, ankle, knee, or hip pain, sometimes shoe wear is the culprit, and we can help you with that. Somebody like me who's an experienced foot and ankle surgeon can be very helpful to help manage in that. There's a lot of sort of, we call paraprofessionals who work around sort of that level of management can help you with shoe wear. There's lots of different types of feet, so I can't give you a specific on that, but someone can help look at your foot, look at your gait, and help you pick a shoe that might help you be more active or do the things you want to do. Somebody might be able to help you pick and set up for an orthotic or an insert in your shoe, which helps you do those things that you want to do. And then there are other things like surgical management that can be beneficial as well. So once you get to the point where you're those over-the-counter things that you're doing, the stretching, the massaging, choosing your own shoes for a little while and kind of working through those things. Once that doesn't work anymore, seeking professional help can be beneficial, because our goal is to keep you active ultimately, is to relieve your pain and keep you active. One of the reasons that I chose foot and ankle is because of the variety of people that it affects. So I see pediatric and adult patients, I see high-level athletes, and I see sedentary people. I see industrial athletes or people who work on cement all day and people who don't. I see executives, I see blue-collar workers, I see a whole variety of people. I never know what's going to be behind the door when I walk behind the door. Unlike some other specialties that may see a certain kind of a person that fits in a certain criteria, that doesn't happen with foot and ankle, which means that foot and ankle problems affect everybody, which is why this is important.
All right, once again, Jeffery Anhalt is an orthopedic surgeon for Mercy Health Orthopedics. To learn more about arthritis or those treatment options, go to mercyhealthorthopedics.com.
And don't forget to check out West Michigan Moves. The Facebook page is awesome. You'll find details on all things health and fitness and a whole lot more.